Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Gambrills, Maryland, which is in the Annapolis, Baltimore area, discussing the benefits of dentistry and how they can help restore your dental health with one of this region's top dentists, Dr. Olga Baczara. Dr. Baczara received her prestigious DMD degree from Boston University Dental School and is widely recognized as one of this region's leading dentists. Welcome, Dr. Baczara. It's a pleasure to have you on our program.
Thank you, Rocco. It's a pleasure to be here.
Your first time, in fact, on Top Doctors Medical Interviews. We've got a lot to talk about. I understand there's some patients that are going to be joining us a bit later, and not to mention a treatment or two that we might see you perform. So let me begin, if I may, Doctor, by asking you if you can please tell us what some of the latest advancements are that have taken place in dentistry and how we can benefit from them.
Well, this is a very exciting time in dentistry, especially in my practice, because I get to use the newest technique that I learned a few years ago, and I see great results, and my patients are happy with them as well. We used to repair teeth one at a time, overlooking the major picture, overlooking the major reason. So now we get to use a comprehensive approach where we look for reason why teeth deteriorate or things don't work, and by approaching that reason or fixing the problem, we achieve better results.
Very interesting, and I understand there's also benefits to us that have taken place within TMJ treatment as well.
Oh, absolutely.
For folks who suffer from neuromuscular issues.
Absolutely. We get to approach broken teeth, cracked teeth, gum recession, TMJ problem as a whole system.
So because of some of these advancements, you now have systems in place that are more streamlined, more efficient for the patients when they come in to correct these problems.
Absolutely. The greatest tool that we use is a comprehensive, thorough exam, where we used to close our eyes and not go into checking the TMJ problem or bite problems. Now we examine that and make sure that we eliminate all problems that caused teeth to deteriorate. And by eliminating the problems, we can prevent teeth from fail again.
Yes, prevention is definitely a big component. Now, as far as some other dental problems that you all are able to help folks with that are watching, can you please tell us about some of those?
Some of our patients are folks that had their teeth fixed a few times and it didn't work. Some of them have cracked teeth. Some of them have gum recession, sensitive teeth, loose teeth. TMJ problems with all variety of symptoms like ringing in the ears and pain in the jaw area or worn teeth.
And those would be folks who suffer from these types of problems that are out there watching would be a good candidate to benefit from the different treatments that you offer them here.
Correct.
Now, what type of results, Dr. Baczara, can we expect from these treatments?
We always think about function first. So we work to improve function, and this allows us to create long-lasting dentistry. And what's interesting is that the looks or form or pretty teeth come as a bonus to that.
Very interesting. So basically you make sure that the function is there, all the fundamentals, so to speak, if I may use that term, within our mouth with our teeth are in place correctly through the treatments that you've touched on, and as a result you would be looking at a better smile if it was a cosmetic treatment that was involved, not to mention the functionality, as we just touched on, that works as a benefit as well.
An example for that would be a person with worn teeth, and if that person would like to have these teeth restored or have them pretty again, it's important to address the reason why these teeth got into that condition, because anything we do in dentistry is brittle, whether we like it or not. So if we do not address the main reason why teeth got into that stage, we are looking into future broken caps, broken veneers, TMJ problems, all the way to loose teeth and further deterioration.
Now, your office here is a state-of-the-art as far as technology. I mean, it's gorgeous. My dental office, when I used to go to my dentist when I was much younger, was nothing like this. I mean, this is almost like a dental spa out here. It's just beautiful, Dr. Baczara. It's certainly equipped with the latest technology. And speaking of that technology, I just wanted to ask you if you can please tell us about some of the technology you have here at your practice and how we can benefit from it.
Well, we opened the office a couple years ago, so I had no choice but to put a newest technology available at that time. We do have digital radiographs, and we have the most comfortable chairs, and patients get to enjoy a little TV or a music show during their treatment. The tools that we use are what we have in modern dentistry, but I have to say that the most important tool that I have is a camera, a digital camera. And with that, I get to take photographs of patients smile, and they get to see their teeth, they get to see their close-ups, and I get to design their smile according to their facial features, to their liking, and that works great.
Well, I appreciate you telling us about that, because that certainly, those are things that I noticed when I did my walkthrough here with your practice and when we did our research on your practice. Very impressive indeed. And these are all advancements that can benefit so many of us, Dr. Baczara. I wanted to ask you, Dr. Baczara, about the new patient experience as far as what one will be looking at from when they contact your practice and the steps that are typically involved.
The new patient experience is unusual here, what people tell me when they come in. Our guests get to meet me, and we schedule a 2-hour appointment when they first come in, so we can get a meeting, and we can get to know each other, and we also get to do a comprehensive exam, which involves taking digital x-rays and photographs, and we discuss all their needs and desires and their problems, if any, and that's how we get to make a treatment plan.
From what you just said, it's really a customized approach based
Absolutely.
on each particular patient's needs, as opposed to a more traditional cookie cutter approach, which you see in a lot of other practices out there. And that's what we've also seen, is that you all really walk everybody through each step to customize a plan that's really beneficial to that particular patient.
Absolutely, Rocco. In this practice, I work with outstanding orthodontist, oral surgeon, and periodontist, and we come up with a plan that is good for the patient and is the best treatment that's available. So not everybody end up staying here in this office. For the completion of the treatment, they get to see other specialists, and they work together with me so we can achieve predictable, long-lasting results.
And from what you just said, you certainly offer your practice here the total dental solution. It's literally like a one-stop shop, because whether it's a general dentistry issue, whether it's a cosmetic desire to give us a new smile, or oral surgery, or any that's needed based on each particular person's situation. So you basically, between yourself and the specialist that you partner with, can really offer the total comprehensive solution for each patient out there.
Correct, absolutely.
We're now going to meet a couple of patients of Dr. Baczara. Welcome, Shavis. It's a pleasure to have you on as well.
Thanks for having me.
Now, I wanted to ask you, Shavis, if you can please tell us what dental problem or problems were you experiencing that brought you here to Dr. Baczara?
Okay. I always thought that I was a very fortunate person when it came to my teeth, because I was blessed with perfectly straight teeth and never had to have a lot of work done when I was a child. And so when I found Dr. Baczara and just scheduled an appointment to go in and get my teeth cleaned and so forth, she did such an excellent job and a comprehensive job in really looking at not only what my teeth were doing in terms of, you know, cavities and the health of them, but also structurally, how are the teeth coming together? What are they causing pain because they're not coming together correctly, that sort of thing. And that was the case for me. I had teeth in the back that actually had started to develop deep cracks. And those cracks were housing bacteria, which was, you know, can lead to numerous problems, and the end result could be actually losing the tooth. So despite having good dental health for so many years, I realized that, you know, I was going to have a significant amount of work that needed to be done, and Dr. Baczara helped me through that.
So then I wanted to ask you, Shavis, if you can tell us what treatment you had done and what was involved a bit.
Sure. The treatment was to take out my previous fillings. They needed replaced anyway, and to replace them with inlays. And my understanding is that the inlays basically were going to address the cracking, any sort of problem in terms of tooth decay, that sort of thing, and essentially hold them together so that they couldn't crack apart and I would lose a tooth. And so, you know, no dentist had ever told me that this was possible or a problem before. So I went forward with that, and Dr. Baczara not only, you know, discovered this issue, but made sure that she really looked at it in a comprehensive way. So what needed to be done to fix my bite so that this would not continue to happen.
So it's corrected and done right.
Yes.
From the get-go, so then you wouldn't have this problem in the future. And how long did this particular treatment take as far as the inlays in your case, Shavis?
It took some time. You know, it was a process because there are molds that have to be taken of the tooth to make sure that the inlay is correct, and it's a very tedious process for the dentist, I believe. And so Olga is a perfectionist and really does it thoroughly. So it does take a couple of appointments, but the end result is really wonderful.
Yes, indeed. And as far as the results go, as you just mentioned, I take it you're very pleased with the results?
Oh, definitely, definitely. No more pain. I don't have to worry about my teeth cracking apart. Dr. Baczara keeps an eye on everything so that if, you know, a problem with another tooth surfaces, we correct it right away. And the other thing I think that's really important to know about this approach is it's not only the general wellness and the overall attention to what's really going on with the bigger picture, but also using excellent materials. Dr. Baczara used gold fillings in my teeth, which I'll have for the rest of my life. And those are, it's much harder. It's you know, I'm not going to have them replaced.
Well, that's wonderful. I'm so happy to hear that. And so it's not just a temporary solution. In this case, you're looking at a permanent solution that took place.
Right, exactly.
And we're literally out of time, Shavis, with you. And I wanted to just ask you here, for the folks out there watching, what would you tell them about your overall experience, not only with Dr. Baczara, but with her staff? And would you recommend them to the folks watching?
Definitely. It's, you know, the staff is wonderful. Dr. Baczara is such a good person and a dedicated professional. I've never seen someone who's so dedicated to teeth and health, tooth health, and so it's a warm place where you get, you know, attention to detail, and it really is excellent care.
Well, on that note, I'd like to thank you, Shavis, for coming down. We always appreciate it when patients take time in their busy lives to come and share some of their experiences with us. Thanks for joining us again and being a guest in our program.
Thanks for having me.
Our pleasure. Welcome, Brian. It's a pleasure having you on as well.
Thank you so much. It's a pleasure being here.
Thank you. We wanted to begin by asking you the same initial question that we began with Shavis, and that is, what problem or problems were you experiencing that brought you to the practice?
Well, when I first came in, I was having some issues with some previous bonding that I had had done on some frontal teeth that were actually chipping away. So that was the initial visit.
And then what happened, Brian?
Well, Dr. Baczara started explaining to me a little bit more about maybe why these things continue to occur. And so instead of just fixing the problem, she was looking more at, let's look at what's truly causing the problem.
Very interesting. So this took place during, I take it, a comprehensive exam?
Oh yeah, it was quite extensive, much more than I had ever been through with a dentist in my past. Not only just from the normal exam, but really looking at the alignment of my teeth and taking lots of pictures so I could actually visually see what she actually was seeing, which I think that's what was very different, is I truly understood what she was talking about, whereas a lot of times when we're dealing with people in the medical field, they speak a language that we don't quite understand, and she made it very understandable for me, and I totally got what she was talking about.
Very good. So then at that point, the diagnosis was made as to what needed to be done, and then what exactly took place after that for you?
Well, after the initial diagnosis, we talked about having to have some orthodontic work, because my challenge was when I was younger, I had some teeth pulled and my teeth basically straightened out, so I was never sent to an orthodontist because, my teeth were straight. The problem was they were straight, but I had no overbite whatsoever. So over 46 years, I constantly was grinding my teeth down just in normal everyday activities, so my teeth had shortened and was causing all kinds of other issues.
So then how long did the orthodontic treatments take? Was it done over a few visits, over a period of time?
Well, the orthodontic part with the braces was about 16 months.
Okay.
And after that, which was a little nerve-wracking in the mid-40s having to wear braces, but it was actually a quite pleasant experience. And after the braces came off, that's when we went in and did some restorative work on my front teeth where basically, like I said, they had been ground down, so the length was too short. So after the orthodontic work, it was kind of necessary to keep my teeth where they were supposed to be to reestablish what they should look like.
Well, you certainly look like you have a beautiful smile now.
Well, it's funny. I always thought I had a great smile until I saw the before pictures and the after. And I think what still amazes me to this day is I will just be in an airport or in a restaurant, and I'll have somebody come up and say, "Oh my God, you have the most beautiful teeth."
That must be a great feeling.
Oh wow, I've never had that before. So it is amazing, and it makes you feel much more confident, And I am in front of people every day with what I do, so it definitely makes me feel more comfortable in speaking with people.
Yes, indeed, and obviously it sounds like you're very pleased with the results.
Oh, I couldn't be more pleased. In fact, several of my guests that I work with in my business are actually patients of Dr. Baczara's now because I was so impressed with her work.
And for the folks out there watching, what would you tell them about your experience, not only with Dr. Baczara, but her staff as well?
It's all about the details. From the minute you walk in and you see the beauty of the office, it's much more like a spa or boutique, very exclusive feeling. And I think she carries that into her work. She doesn't work on multiple patients at one time. You are her focus while she's here, so you know that you're important and that she's truly looking out for what is best for you. And like I said, the details from how everything in the office goes together to the quality of the work she does. And I remember when I was talking to her about the having to get the corrective work done on my front teeth, and she was talking about how it was such a process for her to find a lab that she felt comfortable working with, because she is so detail-oriented, and she wants that for her patients as well.
She's like an artist from what I've seen and heard here between you all and our research. It really is when you think about it. It is like a dental spa when you walk in here, and the work from what we've seen and heard clearly reflects that and mirrors that.
Oh, absolutely.
And on that note, I'd like to thank you, Brian, as well, for joining us and sharing some of your experiences and being a guest on the Top Doctors Medical Interviews.
Oh, thank you so much. It was my pleasure.
Dr. Baczara, we're literally out of time, but I wanted to ask you, before I let you go, you and your practice have certainly established a reputation for excellence in the field of dentistry and patient care. And I wanted to ask you, what would you say helped separate you and your practice apart from many of the others in this area?
In this practice, Rocco, we recommend treatment that will harm the natural tooth structure the least and it will last the longest.
Very well said. Very, very succinct. Right to the point, in other words. And we've certainly found from our experience and our research regarding your practice, from the diligence that we did, Dr. Baczara, before we had you on, that your patients, not only the two that we had on today, but others as well, that you all really seem to go the extra mile. You treat the patients like family, you and your staff, you really care for them. And that's something you can't say about too many dental practices anymore.
Thank you, Rocco.
And on that note, I'd like to thank you, Dr. Baczara, for joining us and being a guest on our program. We'd love to have you back on in the future.
Thank you for having me.